Without further ado, we'll get straight on and into our first speaker. We are very pleased to have Professor Nicholas Watson joining us today. Nick is Professor of Disability Research and the Director of the Centre for Disability Research at the School of Social and Political Sciences at the University of Glasgow. And Professor Watson will be speaking today on the impact of the COVID-19 pandemic on disabled people. Before I ask Professor Watson to begin, can I say that there will be a Q&A at the end of Nick's presentation. So delegates, during the presentation, I would invite you to click on the chat button at the bottom of your screen and type your question or comment there. And Stephanie Fraser and I will pick these up and we'll put those to Nick at the end of the presentation. So can I now ask Professor Watson to begin, if you're there, Nick?
Yeah, I am. Okay, can I've got permission to share. Is that the screen shared? Is that my screen shared?
Yes, okay. I can see it. Great.
Right, okay. Right, okay. Thanks very much, and thanks very much everybody for to Stephanie and to Anna and everybody for inviting me. I'm really pleased to come and talk about this research. Before I start, I should say that this is not just my work. This is there's a big team of us, both from the University of Glasgow and colleagues from the London School of Tropical Medicine and Hygiene when we put this work together. So this is, the credit has to go to them, and if I've got anything wrong, it's their fault as well. So okay, so today's talk, it's not a very pretty picture that I'm going to talk about. I think as I go through, we'll see that a lot went wrong for disabled people during COVID. There was a lot of errors were made. They were left out of a lot of planning, and I think of all of the groups that suffered, you know, we know that 60% of the deaths of people who died of COVID, it was estimated, involved disabled people. We know that disabled people were at higher risk than non-disabled people of getting SARS, COVID. They were at higher risk of than non-disabled people becoming seriously ill or dying. Many disabled people suffered more when routine appointments were cancelled or delayed, and many disabled people experienced more problems than others as a result of lockdown measures. And I think the third key point is that the role of the third sector, but for the third sector, this picture would have been even worse. So I want to move on and talk a little bit about our study and how we actually know this and what we based it on. So I think the first thing to say is that a lot of the disabled people's organisations and the third sector were among the first to start to point this out. There were some really good reports produced by CP Scotland, produced an excellent review of its members. Glasgow Disability Alliance did a big survey of its members. Inclusion Scotland, Inclusion London, Greater Manchester Coalition of Disabled People, the Family Fund, and so on. So these all started to point to problems that were occurring very, very early on in the pandemic. And we got a year-long funded study looking at the experiences of disabled people during the COVID pandemic in England and in Scotland. It's not an aim, there was no intention to set up a comparison to compare the responses across the two countries, although we have got some interesting differences, but I'm not going to talk about those very much today. So I'll draw on this study. This was a qualitative longitudinal study because we wanted to find out what was happening both at the start of the pandemic, but also to see if these things had changed over the years. So we interviewed 71 disabled people and 28 organisations, disabled people's organisations, third sector organisations, as well as key informants from the statutory sector, such as social workers and people from local authority. And we interviewed each group twice. So the first group took place in June, August 2020, and the second between February and April 2021. And this gave us both a chance to reflect back, to get them to reflect back on what life had been like, but also for us to see if any improvements had taken place. I'll be using names when I put names up on here, but of course they're pseudonyms. That everybody is, all the names on here are made up. So I think to start off with, then I think that the first thing we should say, I think this is a quote from the chief executive of a large disability organisation, and they said right at the beginning, I said, you know, when we asked, they said, I mean, without being dramatic, they said, I think it's been catastrophic. I think it's taken existing inequalities that disabled people experience, and it has magnified them and exaggerated them. And I think that that's the lesson that comes through all of this, is that just how badly disabled people went. It's just significantly impacted on their lives, and it's impacted on the measures and the, so I've got to change, that's better. And it's impacted on their lives, and it's exposed them to risk and harm. It's also exposed gaps in their social care and so on. So the key themes that I want to talk about today are the way that COVID impacted on people's day-to-day lives and their social routines, and showing some of the dislocation it's caused. And then to look at, to focus very much on social care and social support and how this was affected by the pandemic. Then I'll do a brief little bit on new technologies, and then finish with the section looking at the role of disabled people's organisations in the third sector and how they responded to the challenges. So I think that the first thing to say in terms of disabling disruptions, that, you know, that routine physiotherapy, speech and language therapy, occupational therapy, all of these routine things were just cancelled overnight, and these caused real problems for everybody, but particularly for young disabled people, people who need new splints, for example, when they're growing, people who needed speech and language therapy, and these therapies were attempts to replicate these therapies either via video conference or phone, but they weren't perceived to be particularly successful. And there's things like that we were told, for example, I haven't really appreciated this, but the hearing tests that are done for children, for babies when they're born, if their child is found to be deaf, they would then have had a weekly or a 2-weekly visit to learn sign language, and these were all cancelled. So there was, all of these things are going to have real long-term consequences for disabled people as we move forward, as we move into the future, and sort of trying to handle these. There's also, I think we're starting to see this, preventable medical problems being missed within disabled people, and for disabled people, this is more important, because these annual checks are there for a purpose, and there's going to be more problems coming through. I think that provision, repair and service of assistive products and aids to daily living was severely affected. And so this led to a lack of functioning and increased dependency for some of them. Young people with disabilities lost up to a year of therapy, of education and socialisation. And I think here, when we talked to parents and children, disabled children, and here I think there was a real problem, especially for those children who received additional support needs. I mean, education was a problem for everybody, but it was even more of a problem for those children who were receiving additional support needs, because they just didn't get it. For example, and people with dementia, I'll talk about this a bit later on, but there was a real problem around losing confidence, about participating in the mainstream, and everybody talked about a decline in their physical capacity and their ability to both travel and live independently. And I know everybody had a decline in physical capacity because of lockdown, but where your physical capacity is more marginal and you've got a more marginal level of capacity, this can become more difficult. And you know, there are people who we spoke to who have lost a lot of ability during COVID. And I think that this is a quote here from it impacted on people's mental health, not just for those people who have mental health, who had pre-existing mental health problems, but for everybody. And I think this is Lily, for example, though, she talked about, she said, I can't go out for fear of dying. And when I do go out, I'm running, I'm moving away from people quicker. People became really scared, and there was a lack of knowledge about what to do. We spoke to a person with learning disabilities who was so scared that every time they came back in from shopping, they were pouring bleach over themselves, and they ended up in hospital covered in bleach because they'd been left on their own without support. They didn't really know what to do. We got told about people who self-harmed when they became depressed. People became agoraphobic, and many were too scared to go out when lockdown was eased. And while the demands of social distancing obviously interfered with everybody's ability to connect, for disabled people it was particularly difficult. And this is, I think, a quote from somebody who's blind and uses a dog. Yeah, it's the social distancing, LD dementia blind. Oh yeah, blind, yeah, assistance. Dogs are not trained in social distancing. Don't jump the queue and go straight to the door. Can you imagine the social consequences of that? So I've got any number of blind friends with assistance dogs who are normally really independent, who are now not going out except with family because they're saying their risk of them being bluntly being thumped is too high. So people talked about, because of their impairment, it made it harder to social distance. But they then got scared of being shouted at. And a deaf woman we spoke to, or hard of hearing, said that wearing face masks and covering would really affect her ability to go shopping. If she asked the shopkeeper to take the mask off to speak to her, she often got abuse and was told that she shouldn't be putting people at risk. So there was this it led to a new stigma almost emerged about being disabled and came through. So just looking at how it's impacted on things, I want to move on to look at social care. And I think that the first thing to say is that COVID has really increased disabled people's reliance on the family and other informal carers. We saw the closure or suspension of day centres and day services and large sections of the social care system. Large numbers of social care contracts were cancelled, although interestingly, many disabled people still got charged for these contracts, even though they were carrying on. And some were still being charged for services that weren't in existence even as late as April this year. And they were put on hold or severely limited. And I think that, this was done almost overnight with next to no consultation, and I think this is the big thing. Nobody's saying they shouldn't have closed the centres. Nobody's saying we shouldn't have stopped the services or shouldn't have changed the services. But nobody looked at the impacts this would have on their lives. So this is a quote from Abby, who's a caregiver of Morris. So her service provider, who provide most of Morris's care, phoned me up and said, obviously this virus is getting more serious, so we've had to prioritise the support we provide. And in 2 days, Morris's care will be ceasing altogether, and it's over to you. You need to now cover all of it. So as you can imagine, that was a surprise. So this was just coming in. Some people, I think that Abby, who's Morris's caregiver, it was fortunate in a way for her that she went onto furlough, so she was able to look after Morris. But if she hadn't gone onto furlough, nobody would ask her what to do. But nobody phoned her up to ask her how she was getting on for 6 months. So I think this is part of the problem. And I think in Glasgow, one of the disabled people's organisations told us that these type of cuts had happened to over 1,800 care packages in the city. Overnight, it was withdrawn. They stated that this was done in the most brutal of fashions and left many people with absolutely no support. It really does worry us that we are not going to get it back. And I think Stephanie was on the radio yesterday saying 75% or 66% of people with CP don't have their full care package back. I can't remember the exact number, but something like that. I think that people, so Adams, for example, self-directed support, the SDS package was reduced from 24 hours support a week to just 6. And this raised real concerns as to how he and his sister, with whom he lived, would receive even basic food supplies without the help of his remaining support and those within the local community. So my sister and I are both shielding, so it was just not being able to get out, get shopping in. We've got good neighbours and that helped us, but really we were struggling to manage without PAs coming in. So I think people were just left high and dry. I mean, Adam was lucky that he had neighbours, but some people didn't have these neighbours to help. They're going through. So the cuts in services weren't just implemented by local authorities, they happened across the board, private sector, all of these came through. People also, I think, received little or no guidance, especially in the early days, on how they could get their support into their home, how they could make that support COVID secure, or where they could get PPE from. And there were all the focus at this time, if you remember, was on care homes, and it was mostly care homes for the elderly. Nobody was talking at all about people in receipt of domiciliary social care. And this represents over half of the number of people in receipt of care. Those without family or friends were left feeling lonely and unsupported. The response to this demonstrates, I think, a complete lack of understanding of both the role and function of these services. For many of our participants, activities such as art clubs, drama groups, book clubs, and similar provide structure, they provide routine and security, and most importantly, they provide their community. It's where people meet people, it's where they have their friends, their friendships, their local things are contingent on going to these activities. We might think that's wrong and that they should be more part of the community, but the way it's set up, that's how it is. And when they were removed, people were just left on their own. As a woman said to me, you know, it's been me, the cat, and the TV since last March, and this was in February this year. So people just were left on their own. Day services, they act as platforms to socialize, and people missed their friends, they missed their connections. During the pandemic, people felt isolated, lonely, and a sense of wilderness. So people lost their independence. This is Frances. Frances spoke to us, interviewed us by repeated emails, how she wanted to be spoken to. She said, I also feel my independence has gone down now. I am always with my parents, or if we go out, they're always supporting me, but I'm not having my independence like before. I was out on my own and using public transport. Also, my freedom of choice is reduced. There's less opportunities to choose that are of interest to me. Now I am transported by cars all the time by my parents. It's very hard as they change daily depending on how I'm coping. I often feel sad, no clubs and hobbies available yet. And so this is, I think this is the whole thing here, removing these dates, these clubs and things actually impacted greatly on people. Many expressed that without the stimulation provided by these services, the social action, they started to lose hard-fought life skills. Caregivers were concerned that they couldn't provide a stimulating environment or the variety of experiences that these things. So this is from Priscilla, who's the carer of Lucy. It's a real concern to, well, most of us, that it might never reopen. And that's been suggested as a possible case scenario. This is a real worry, because as I was saying earlier, Lucy's health and well-being have been impacted on because she hasn't been able to go to a day service. She needs to be out and about. She needs to be doing. She needs more challenge than she gets just from staying in the house all the time. So people are having all this, and I think that these feelings of isolation and loss led some to show increased instances of distress, evidenced through challenging behaviours, including violence towards themselves and, in a couple of cases, towards other family members. As well as removing services already in place, care assessments were also put on hold from February 2020. And in some local authorities, these lasted right up until October or even November last year and beyond. We were told of examples in February 2021 where people could still not get assessments. As one of the social workers we interviewed conceded, this had both an immediate impact and raised questions about future support and whether it would be available. I've got quite a few service users of mine where they've been kind of left in limbo, a little bit at the moment, and they were partway through the process before the pandemic, and that's kind of stalled because resources are getting moved around with the local authorities to look at other things as a priority at the moment. The pandemic brought with it, I think, also a strain on care workers, and we were told of instances where care staff inevitably struggled with the physical and mental toll of the virus. Some care staff had to self-isolate and when this happened, individuals were often left without support. I think the one thing that I want to talk about and move on and talk about is that the key, the key thing is the role that organisations of disabled people played in this, and I think so. The evidence from our research demonstrates that in general, the third sector organisations responded quickly and really effectively to the COVID crisis. In a matter of days, the organisations we interviewed had repurposed themselves, adapted and developed services and supports, sometimes in operating in entirely new ways. They hand-delivered iPads, they hand-delivered computers to their members, they recognised the loneliness that disabled people were facing. They set up online communities. A whole range of activities moved online. They set up karaoke, they set up friendship groups, they set up things like dating, online dating, and so on. And all this was achieved amidst significant upheaval and personal upheaval and uncertainty, including managing changing regulations. There was funding challenges going through. They had staff on furlough. They had a reduced number of volunteers, and also, importantly, many were running on reduced resources because they weren't able to do the normal fundraising that they might normally do during COVID. And they had to repurpose their IT systems to allow for online delivery. But despite these challenges, organisations were driven by a single focus to meet the needs of their members and service users. The people we spoke to used really emotional and evocative language to describe the role of the organisations that they worked with. They talked about them being a saving grace. So Isla, a woman with dual sensory impairment, spoke about the disabled people's organisation she was involved with. They're just saving my life at the moment, psychologically, that lot. Belinda, a woman who had mental health issues, said, I would be in a really bad way if they had their funding withdrawn. I think it's not fair. It's fair to say that for many, the third sector were literally a lifeline. The sector attended to a whole range of activities, from the most basic, such as the provision of customised food parcels and prescription delivery, to actually the defence of human rights. And it was disabled people's organisations who spoke out against the use of do not resuscitate orders and applied to vulnerable people without their consent. They were also very active in demanding the vaccine for people with a learning disability, who have had to remember at the start of the vaccine programme hadn't been included in the priority groups. So at the outset of these organisations, like I said, they set up online and phone surveys to highlight the extent of the problem. The third sector provided a bulwark against the isolation of the pandemic, particularly amongst those who were shielding. Emotional support was made available through helplines, through helplines and so on. And there's Jason, a man with physical disabilities and mental health issues, said, you know, for example, there's a mine volunteer who phones me on a Friday and has been constant through lockdown. So I've actually looked forward to that. Third sector organisations, normally we would say that third sector organisations act in what we'd see as supplementary, complementary, and occasionally adversarial roles to the state. This is in normal times. So they respond to demands unfilled by the state. So that's when it supplements it. It complements it by working in partnership to provide contracted services. And occasionally it's adversarial, where it lobbies for change in policy and ensures the state is acting in public interest. Of course, all three can happen at the same time. During COVID, I think the third sector played a different role. Rather than being supplementary or complementary to the state, I would say it would be more aptly described as compensatory to the state. The pandemic, the framework, the role played by the state, the sector was a central actor. It responded to the needs of disabled people. It substituted for the state. It provided emergency cover. Where the state withdrew from its role, the sector stepped in. And I think what is unique about the pandemic is that actually at that time, the state became reliant on the third sector to support its citizens in areas that are largely the responsibility of the state, such as domiciliary care. The sector, despite it has much less resource, it has much less capacity, but it was the sector that mobilized most effectively in the face of the pandemic and was able to meet its citizens, the needs of its citizens in a way that the state just failed to do so. And I think that if we look to going to the future, and many of the inequalities I think that I've highlighted were the result of pre-existing inequalities that happened, but it amplified them. And I think this is what, as we look to go forward and the lessons that we take from this, I think this is from a program coordinator. Says people say they want to go back to normal. We don't want to go back to normal because normal wasn't good enough for disabled people. For disabled people, then lessons need to be learned from the difficulties and solutions identified in the pandemic, both to enable better provision now and in case there's any future shock to the system, such as climate change and other ongoing disasters. We know that the UK social care system has been broken for some time. Its vulnerability has been exposed by the pandemic. So whilst the COVID-19, I think that we've had a lot of governments, both in north and south of the border, have committed their administrations to major reform of social care. The findings, we've got the Feely review, and they've been broadly welcomed. The centre on a proposal to shift the paradigm of social care support to one underpinned by a human rights approach, and to develop a new national care service. This would remove, I think, social care. One of the issues that we would see both here, and there's a talk of a national care service down south, but one of the issues we would like to see is to make sure that that for us, the most important thing is to keep the third sector strong. If we want to take this forward, the one lesson I think we could really take from COVID, and I think it's important that we look for positives from what has been a dreadful thing. The one thing we can take forward is that the key role of the third sector, if we want to ensure our social care continues, we want to provide better rights and better support for disabled people, it's the third sector that we need to be ensuring is well supported. Thanks very much.
Thanks. Thank you very much, Professor Watson, for that presentation, which was, you know, a really quite a sobering and hard-hitting summary, really, of you know, what's been happening over the last 18 months or so. Before we begin the Q&A, can I just remind delegates, please send in questions or comments for Professor Watson. You can do that in the chat area. So just click on the chat button and type your question or comment. And if you want to, if you're feeling brave, you can click on the reactions area and then click on raise hand, and we can invite you to unmute and ask your question directly to Professor Watson. So I can't see any questions as yet coming in. I wonder if I could maybe invite.
Question,
yeah.
Sorry, I'm sort of pulling rank on this one. I'm sorry, but I'd love to ask Nick. Does he have a feeling? I hear loud and clear his call that we all want the third sector to ensure that a strong third sector, if we are going to ensure care and services transform going forward. I wonder if he gets a sense about the size of third sector organisations, because it seems to me that there was a lot of you know, organisations that knew their community very well were the best placed to help. You know, was there something about the sort of extreme localness, or you know, were very big third sector organisations, for example, sort of caught in the same problems as the state sector? I don't know whether he has a sense on the different size of organisations making a difference.
I don't think. I mean, we didn't get that. We didn't find that even some of the biggest organisations in Scotland and in England, although they're big, they tend to be quite localised as well. So they tend to be. So if you think they tend to have local organisations that are or localised versions, there may be a large organisation, and I think it was just what they had was the ability to change really quickly and to move very, very fast because they're very flexible. And I think we didn't see that because the private sector are mostly providing contracted services, that their services were hit quite badly as well. It was the third sector, and I think part of it is also because the people who are working in the third sector in that way, there's a rights-based approach to their work. They work in that area, and the organisations exist to meet the benefits of their community, and they're only focusing on that. And I think also one of the things that happened at the beginning of COVID, if you think, we spent a lot of money opening up Louisa Jordan hospitals and Nightingale wards and everything, and nobody did an equivalent on social care. There was nobody, and I think partly that was because I think health and social care integration is a great thing. I think it's a really, really good thing, and I think that they should work key together. But the problem is social care plays second fiddle to health, and always will do. And I don't think ministers or people have the bandwidth to manage both health and social care. And I during the early stage of COVID, I had to go to the hospital to get something, and there were beds lined up all around the Queen Elizabeth, all along the wards, because they were expecting. They didn't know what to expect. And I think this is not trying to criticise the focus on health, because people were terrified. They thought we could have had hospitals overrun. But what it meant was that nobody was fighting for social care. The only people who were thinking about social care were the third sector, and they were the only ones who were pulling it through. That's why I say I use the word that they compensated for the failures of the state. And if it hadn't been for organisations setting up food parcels, delivering, and we got told of examples. People who were working in the learning disability service were repurposed to work in care of the elderly. So one organiser of care said, I look after 55. I look after 55 people. I now only look after 14 as a service because all of our staff have been moved to care of the elderly, and we only look after the 14 most who are in most need. So I think there was a real shift in that way. There was a shift from, and nobody talked. As I said, nobody mentioned domiciliary social care at the beginning of the pandemic. It's still not talked about.
I see we've got
Yeah.
some other questions. So if I could bring in Richard Luke and then John Gallen after Richard.
Hi Nick, thanks for the very sobering and upsetting research. In my work, I have tried to support dozens of parents in England and Wales through the pandemic with a lack of paediatric appointments, speech and language therapy and physiotherapy, sometimes physio only being offered via Zoom. My question is, do we think there is going to be a longitudinal study of the impact of the lack of therapy on children during the lockdown to compare outcomes if the lockdown hadn't have happened?
I mean, I'm not sure that they can do a compare outcomes, but I think there should be work ongoing on looking at, have needs for disabled children, are they being met? And I think that it's any of these sort of responses to COVID needs to look very, very closely at the needs of children and what do we need to do to get them back to where they were in terms of speech and language therapy and physio. And I think you're right, most of the parents we spoke to who were talking about language therapy and physiotherapy. It just wasn't working over Zoom. It just, even though they tried to do it, it didn't work. And I think part of, well, we're not trying to be critical of people. You know, people. The other thing to remember is a lot of people didn't want other people in their houses. It was quite rightly because they were very frightened. So, you know, the physios probably wouldn't have got in if they said we're going to come round and do physiotherapy, because people were quite rightly very frightened about this. But I think what we need to do is we need to make sure that there is some form of proactive service to make up for the loss of support that disabled children have had during this period. And I think also that has to happen in schools, that they should be a key target group for recuperation. Yes.
Professor of Disability from Glasgow.
Sorry, John Gallen is the next one. If you're not asking a question, could you put your settings to mute, please? John.
Hi, Mr. Watson. Thank you for your presentation. It was very powerful, and no wonder people, it's been a huge difficult time for everyone. But my question is on day services. You know, I don't understand why day services are not back open yet. Now schools are back open. Why are not day services? Because you know, there's so many people dying to go back to day services, and you know, social workers are not bothering to look at the situation and to get more money in to, you know, to get day services back for people with disabilities. So can you tell me your thoughts on that, please? Thank you.
I mean, I think, John, I think it's a really good point, and I think it's become an excuse, and I don't want this to become a social work bashing session, but I think every time anybody asks anything to get a new service or get a service put up, the response of the local authorities and everything seems to be but COVID. You know, if you ask it, say why, they'll just go COVID, and it's become. I think I don't know why some of the services aren't reopened, John, and we know that there's still services not being opened. I think there's a worry that whether these services will be reopened is a real concern, and I think so.
So have they tried yet, Professor Watson? You know, they need to try this. Yeah. So how are they supposed to know what it's like? So they need to get a taster.
I think you're very right, John. But also, I also think there's a need that they've got to as well. I understand why people have to be careful. You know, people with Down syndrome are 6 times more likely to die of COVID than somebody without Down syndrome. So I can understand why, if you were operating a service, you would be reluctant to open up a service that brings lots of people with Down syndrome or learning disability together, and then they all got COVID and died, and they'd all be. So I think there's a real challenge of risk here. But I've spoken to people, we've spoken to, a couple of people I spoke to with Down syndrome wanted the service to be open and said that they would take that risk, and because they wanted to be with their friends. They were finding it really hard being at home.
Thank you.
I think we've got a question from Jennifer Casti.
Hi there. So I'm the parent of a young person with cerebral palsy, and I'm wondering from what you've been saying. I mean, it does chime in with our own experience, although I have to say we haven't been particularly badly hit in comparison. But I just wonder if you think this is a symptom of like a more general just lack of engagement and understanding of the disability community amongst the statutory services, because I see it all the time. They don't evaluate. They're not really interested in our opinion, despite the fact that it's freely offered by lots of people all the time. They just don't really want to engage, and I kind of feel that disabled young people are just sidelined a lot of the time, and people are not interested in them. And I'm wondering if you think that is a factor, and whether you think there's something that we as a society should be doing about that.
I mean, I think that's exactly right, Jennifer. And I think, you know, one of the things that comes clear is that nobody consulted with disabled people. That the state didn't consult. It was the reason why the third sector were able to respond so quickly was that they spoke to their members and said, "What can we do for you?" So, you know, Glasgow Disability Alliance phoned around 5,000 people in the first month of the pandemic, asking people what did they want, what do they need. So they set up a service to meet the needs. Local authorities just stopped. And I think that's one of the problems. In the schools, nobody said, well, I mean, if they'd sat down and said, well, look, we can't come in because of COVID, but what can we do? What support can we offer? But I think it's indicative of the way that services are run, where they're done to rather than done with. And I think that's one of the differences. And local authorities don't need to work that way. They can be much more about co-producing and could be about much more about co-working. But I think like I said, the focus shifted from disabled people to care of the elderly. And I have friends who are social workers, and they said they've never worked harder, and I believe them. But I think that just that the disabled people, they got left behind, and I'm sure that they did. Nobody did this deliberately, and this is just it's just the function. And I think your point is quite right that, you know, disabled people are left behind because they're not spoken to and not consulted with. And this has really been the danger of this has been shown during the pandemic.
I just wonder, is that being captured anywhere, and is there something that we should be doing about that?
Well, the stuff we've done has been done by, I think, you know, in both countries now, we've got a big review of social care, and there is a chance to sort of put this through and say, you know, it is about working with disabled people. The way to get this care and support, I think, is to work with, and it's certainly, I think, you know, it doesn't have to be a small organisation, but it has to have local ways of working. That's what makes the difference. So, you know, Enable have lots of small communities approaches around the country, so they're able to, they operate differently in Aberdeen than they do in Glasgow because they take account of the needs of Aberdeen, and that's the thing that you need to have. So it's that sort of bottom-up development that can go through, and you can work in these different ways of coming through. And I think it's, you know, what will happen as we don't know what will happen in the future when we come through with the National Care Service or with or both here and in England. But I think that the one thing is we do know that localism works best. And I think the other thing to say is that in countries where integration of services works best, it's worked in where it's been done in very small areas.
Thank you.
Okay, thank you for those questions. My clock here is showing that we're very nearly up to time, so I think probably if we could just wrap up questions there. But thank you everyone for all those questions, and in particular thank you Professor Watson for joining us today. That was a really great scene setting presentation, and you know, we really thank you so much for your involvement today.
Thank you. Thanks for having me. Thank you.
Okay.